So this is just a quick slide that gives you what we call the anatomy of incontinence. And basically the takeaway here is you have to have a bladder that works, and the bladder is a muscle, and so that muscle needs to be able to expand and contract. And one of the things that keeps the bladder toned and able to expand and contract is your ability to walk and get up and down from a chair. And so when we have elders who are struggling with activities of daily living, including getting up out of a chair and also walking, I want you to be thinking about the fact that this also can weaken their pelvic floor muscles that support the bladder and also the bladder muscle itself. Also recognizing that looking at that center picture where you can see how the kidneys are responsible for processing and creating the urine, and you see the ureters or the tubes that go from the kidney into the bladder for filling. This is a really important connection to be able to make also, because in some of our patients who do lose muscle tone or who are on medications or who are just prone, some of our men with enlarged prostates who are very prone to urinary retention, where the bladder is not emptying well because the muscle's weak and it's not getting the messages that it needs to release the urine in a normal way. It's important to recognize that you want to address that problem because urine can reflux into the ureters, and that's one of the ways that pyelonephritis or kidney infection can start, or there can be stones. So there can be lots of issues. It's also important that the urethra is intact, and that's particularly true for women. Women are very prone to having relaxation of the and thinning of the urethra in response to a loss of estrogen, which is a normal process when having gone through menopause. And it seems as if the farther out a woman is from her menopause, the more at risk she's going to be for this thinning and relaxation of the urethra. And that does predispose her to some leaking as well as urinary tract infection, because that urethra doesn't stay nice and plump the way that it should. And it's one reason that why one of the treatment modalities for women is to be able to use some topical vaginal estrogen to help restore the integrity of the urethra. The final thing I'll say about the neurologic system is, what happens in the brain travels right down the spinal cord to the bladder. And so when you look at different medications, when you look at different disease processes that are going on that have a neurologic component, it only makes sense that you would have these connections and that they could be contributing to bladder problems. Now, I could spend an entire lecture on the anatomy of continence, but I'm not going to do that because I think you've got the big takeaway points here of how I want you to generally be thinking about this within context of the patients that you're seeing.